Good morning, and my thanks indeed to the Animal Politics Foundation for inviting me to speak today. It falls to me to introduce the subject of dog population management. I aim to do that by describing an ecological model of dog population dynamics and how we can use that to intelligently design a management intervention that utilises only ethical tools for intervention. So I'll be here representing ICAM, Coalition today, and IFAW. I would like to start by defining this term ethical within the context of this presentation. So I've taken it to have three main aspects. First of all, I believe ethical dog population management, or ethical DPM, respects the sentience of animals. So that's the capacity of dogs to suffer and therefore engages only in humane activities. Two, I believe that ethical DPM should engage the human community fully. The people that live with and amongst these dogs have a right and a responsibility to be involved in their management. And their consent and action should be sought at every stage of the intervention. And three, I believe that ethical DPM must strive to be efficacious and sustainable and should be objectively monitored and adaptively managed to ensure that it is that. Now, I'm conscious we have a very international audience here today, and there is geographical variation in dog population dynamics, the problems that they present, and therefore the suitable management. But I believe there are general concepts that are relevant to us all, and it's those that I'd like to expand upon today. I'd like to just start by also describing who ICAM is. So we are the International Companion Animal Management Coalition. We were formed in 2006 and we are comprised of a group of international NGOs and specialist groups. We came together to discuss our knowledge and experience of dog population management, to share both our successes and our failures, and to learn from each other. We publish this shared learning in guidance documents which are freely available from our website, and on a regular but infrequent basis convene conferences to widen this learning and to encourage DPM science, which is thankfully increasing in both quality and quantity. Our next conference will be next year in September 2018. It'll be held in Kenya, and it'll be the third in this international DPM conference series. So I'm going to be drawing very heavily on these two ICAM documents for this presentation. First of all, the humane DPM guidance, and secondly, our more recent publication, Are We Making a Difference?, which I'm going to describe in a little bit more detail later on. So we're going to start with this array of your classic roaming dogs. I'm using the term roaming dogs. You could also describe them as stray dogs or street dogs. Importantly, my definition of a roaming dog is a behavioural one only. So I'm describing a dog that is currently in a public place roaming without the supervision of a person. I do not imply anything about its ownership status through the term roaming. Now, we know these dogs can cause a number of problems. Dog bites, disease transmission, in particular rabies, road traffic accidents, defecation in public places and associated issues with parasite infection, predation of livestock and wildlife, aggression towards pets, not just people. So we hear dog owners sometimes talk about the challenges they have in taking their own dog for a walk in public places because they're nervous of how roaming dogs will interact with their dog. And then this issue of the look and feel of the streets. And this sounds like a very minor issue, but it is mentioned quite frequently. And it reflects a perception that the sight of roaming dogs is no longer acceptable or fitting to the town or city in question. So it reflects an issue of perception. And you can also look at this through the lens of social capital. So social capital describes those things that people really care about other than economics. So things like goodwill, social interaction, social discourse, feelings of safety, and feeling empowered to make positive changes within your community. And the walkability of streets is just one aspect that can impact upon your social capital. And it describes how friendly the streets are to walk about in and whether there are any areas that you avoid because they make you feel unsafe. And of course, there is a potential for roaming dogs to therefore impact upon the walkability of streets and therefore impact upon people's social capital. But we also know that the dogs can suffer themselves. There are many animal welfare issues involved. So the dogs may be suffering on the streets in terms of malnutrition, illness or disease, and they may also suffer at the hands of inhumane control attempts. So in those locations that have roaming dog populations, we know that roaming dogs can figure quite highly in the list of complaints to local authorities. But it would be a mistake to assume that people are only concerned about the problems caused by dogs. They're just as likely to cite problems relating to dog welfare. So to ring up to complain about a litter of puppies that have been abandoned in their streets and are now suffering, or to ring up to complain about cruel behaviour, cruel handling on the part of ill-prepared animal control officers. So people look to these dogs as the cause of these many problems, and it's at this very early stage that a number of assumptions can come into play, untested and mistaken assumptions that can lead to later problems in management. The first assumption being that all of these roaming dogs are unowned and nobody cares about them. The second is that they are all born on the streets. Their parents were also roaming dogs. And if you believe both of these assumptions to be true, you may conclude that if you could just remove all of the current roaming dog population, the problem would be solved. However, we know this is not the case. So on this slide over here, we see dogs that have been culled with strychnine in Nepal. Many tens of thousands of dogs were culled in this way over many years with no seeming change in the rate of culling that was required. So they ended up in this endless cycle of culling and replacement and culling and replacement. And over here we have a classic example of an overfull shelter. So even when you have developed a system of capturing roaming dogs alive from the streets, you may find that you just transfer the problems to this new location. And this kind of situation is highly unethical based on the definition that I described in the introduction. So you have the suffering of sentient animals. Communities are horrified by such places and avoid them. Therefore, there's very little rehoming potential. These places fill up very quickly, so they become ineffective, and they're incredibly expensive to run. So what's our alternative? Well, ICAM have been promoting this ecological and evidence-based approach, starting off with looking at this population of roaming dogs and asking what are the subpopulations within it. So not considering this an amorphous mass of dogs, but asking what are the subpopulations. And then perhaps even more importantly, asking where each of these subpopulations is coming from. And you could describe these subpopulations as states and these sources as processes with a sort of ecological mindset. The terminology doesn't really matter. If you were using an economic model, you might describe these as stocks and flow. But what matters, what's important about this approach, is that it starts to focus you on the source of roaming dogs. And then you have a chance that your intervention may actually be able to address the cause of the roaming dog problem and not only the symptom of the current roaming dog population. So if we look now at these roaming dog states, we can see over here we have three different dog types within this road icon, and these are all different types of roaming dogs. First of all, we have this population of owned roaming dogs. They have a single referral household, but the owner allows the dog to roam for at least part of the day. Then we have this community-owned dog population. They have no single referral household, but they have several people within the community that offer limited care, such as food, water, and potentially also shelter at different times of the year. And then at the bottom there, we have this unowned dog population. And these are usually majority abandoned owned dogs. You may have some feral dogs as well, but they're actually relatively rare considering the amount of media attention they sometimes get. So feral dogs are usually relatively unsocialised dogs. They survive on resources not purposefully provided by people, so they live, for example, outside slaughterhouses that are discarding offal or around municipal dumps. Their survival tends to be very poor, their breeding success even worse, and so their numbers tend to be maintained by recruitment from other states. And I think it's important to note that a single dog may be all of these different states within its lifetime. It may start out as an owned roaming dog and then through the process of abandonment join the unowned dog population. Because it's charming and because the community is kind, it may then join the community-owned population and receive resources from a number of different people. If it's very lucky, it may then, even through the process of adoption, rejoin the owned dog population. So if we look back at our examples of roaming dogs, we can see these different subpopulations. Down here in the bottom right-hand corner, we have an example of an owned roaming dog. So this dog is owned by the gentleman that lived in this house, but he's allowed to roam whenever he wants to. Down here on the left, we have an example of a community-owned dog, and this is from Jaisalmer in India. Very charming, friendly dogs. No referral household, but several people within that community that offered food and water. And then up at the top here we have two examples of unowned dogs. Firstly, this dog in Puerto Rico, a pit bull type that had been abandoned in an area well known for abandonment of pets, and he was in a pretty poor state. And then this dog here also visibly suffering from a skin problem. The source of this dog was quite difficult to ascertain. This was in Panama City. It's very likely this dog was also abandoned as an adult because puppies tended to have relatively poor survival on the streets in Panama City. So we have these different subpopulations of dogs. The question now is, where did they come from? And this is when we start looking at the processes, and it's at this point that we need to widen our perspective. And I do sometimes feel that the term stray dog control can be misleading because it focuses us too closely just on the current roaming dog population. And I think what we need to do is to look at the whole dog population and manage the whole dog population and the processes within its dynamics. And DPM interventions are designed to drive these different processes to change the states in a targeted way. So just in order to describe this diagram in more detail, over here we have the processes of death. And this is where classic catch and kill interventions are focusing their effort. Of course, they may also end up incorporating some owned roaming dogs in that catch and kill effort. And then over here in this yellow column, you can see the processes of birth and recruitment. Recruitment being the survival of puppies to adulthood when they join the breeding population themselves. And it's these processes that catch, neuter and return, or CNR, are focusing upon. So catch, neuter and return describes a tool where you catch roaming dogs on the street, take them back to a central clinic or mobile clinic for vaccination, sterilisation, and then recovery and return to the point of capture. There is the potential for owned roaming dogs to also be caught into this tool with associated issues around owner consent. And CNR does also have the potential to impact on some of these other processes that are more related to human behaviour. So we have the process of community engagement or disengagement, and these processes of adoption and abandonment. And how the CNR tool is run, its public messaging and its level of community engagement will dictate how it impacts on these processes. So just as an example, you may consider engaging expert catchers to go out bright and early in the morning to collect roaming dogs from the street, a very efficient process. However, it runs the risk of potentially disengaging the community from its community-owned population of dogs. Consider as an alternative demanding that the community itself that is feeding these dogs bring you the dogs for sterilisation, or at least helps you identify those dogs and helps you handle them, potentially also offering post-operative care to those dogs immediately after sterilisation. If we take that approach, we have the potential of increasing the level of community engagement. You may even manage to drive some of these adoption processes so that some of your community-owned dogs may join the owned dog population. Now, that's an untested hypothesis, but I think it's worth keeping those kinds of processes in mind when you look at the detail of how you run this C&R tool. So over on the left, we have these processes of acquisition, the sources of owned dogs, and it's here that legislation of breeders and sellers and owner education is planning to have an impact. And over here we have these processes related to responsible dog ownership. So we have breeding within the household, we have the resourcing of dogs to ensure that they do not need to roam to access additional resources, and of course we have the processes of adoption and abandonment to the street. And it's here that the legislation of owners and identification and registration are aiming to impact. They will also be aiming, of course, to impact the process of reuniting lost dogs with their owners. It's these processes that increased accessibility of veterinary services will aim to impact. So decreasing unwanted births within the owned dog population and therefore potentially reducing relinquishment and abandonment of unwanted litters. And then when we look at the education of owners, we can see there are many processes that we have the potential to influence. So really just a general point at this stage is that when we look at all of these processes within dog population dynamics, we can see that human behaviour is a core determinant of the majority of these. So when we're looking at running efficient and effective DPM interventions, we need to ensure that human behaviour change is a very important part of what we're doing. Now, I have neither the time nor indeed the expertise to lecture on human behaviour change today, so really as a way of a kind of a cheat, I'd like to mention this book, The Behaviour Change Wheel, which I found particularly useful when looking at behaviour change interventions within DPM. The behaviour change wheel uses the COM-B model, so it looks at a person's capability, opportunity and motivation to perform behaviour. And this book takes you from that initial behavioural diagnosis where you're exploring why someone does what they do, through to intelligent intervention design that hopefully will allow you to create sustained behaviour change. So just to emphasise that point, I think when we see this array of roaming dogs, there is a risk that they are perceived to be urban wildlife, and this is considered a veterinary concern. Now, there is a very significant veterinary component within DPM, but I think just as importantly, we need teachers and marketing experts, social marketing experts, to help us to change what people do, because these are truly domestic species. Their birth, their survival and their behaviour depend very closely on what people do to them. Okay, so I hope I've justified now the reasons why you would try to understand dog population dynamics in order to allow you to design intelligent DPM. And so the question remains, how do you actually gain this understanding? Well, you can use a combination of methods to start to explore population dynamics, and these methods are described in a lot more detail in ICAM's Are We Making a Difference document. So you can start with secondary sources of data, so accessing local authority data or hospital data to explore those problems caused by dogs. So for example, dog bite data. Look to see if there are temporal changes or geographical patterns in those problems, or indeed whether there are particular dog types intimated by that data. We can also look back at historical DPM efforts. They will be a mix of both successes and failures within those. So you want to evaluate those in order to learn from them and inform your next stage of design. And then you can also start to look at the current dog population. So you can use street surveys of roaming dogs, as this gentleman up here is doing in Panama City, to explore the density of roaming dogs, their geographical spread, their gender, their welfare, and whether they're breeding by looking for lactating females on the streets. And then you can also use household questionnaires, as these gentlemen are doing in Puerto Rico. And those will allow you to explore owned dog demographics. So age structure, the gender of owned dogs, whether they're sterilised or not, and the sources of owned dogs. It'll also allow you to start to explore some of those care behaviours, so how owners are caring for their dogs. So whether they are sterilising them, vaccinating them, allowing them to roam. And then you want to go a stage further and start to use things like focus groups or semi-structured interviews to explore why those behaviours are occurring. And through this process of initial assessment, you'll also be able to establish baselines for important indicators, such as the density of roaming dogs or the current sterilisation rate of owned dogs. So I'd like to share with you now an example of initial assessment. This is from an IFAW project in Bosnia and focused on a particular municipality called Trebinje. So through a combination of street surveys and household questionnaires, we found that 35% of households owned dogs. We found that 20% of those dogs were allowed to roam for at least part of the day. We found that 20% of owned dogs were sourced as puppies from litters that were born within that same household. And we found that just 20% of females were spayed. So from that we could conclude that there was limited spaying and that the owned dogs were breeding successfully within the households. We also asked people if they knew about litters that had been born in their neighbourhood in the last year. Of the people that said yes, 26% knew that at least one of the puppies had been abandoned from that litter to the streets. So then we can conclude that abandonment of unwanted litters was indeed a source of roaming dogs. When we looked at the current roaming dog population, we saw that very few of the females were lactating. In fact, there was just one female in particular from the community-owned dog population that was lactating, and she was known to be quite a successful breeder. When we looked at adoption from the streets, we found that 8% of owned dogs were adopted directly from the streets, but just 1% had been adopted from the local shelter, which was a shame because there was quite a large population of dogs there that had the potential to be rehomed. So using that process of initial assessment allowed us to focus on those processes that we needed to target as a priority for our next phase of the DPM programme. So we wanted to focus on increasing access to veterinary services so that we could help to decrease the birth of unwanted litters. We wanted to increase adoption from the shelter, try and make that a more attractive potential source of owned dogs. And we also wanted to have a look at a little bit more detail at the issue of abandonment. So we also understood that there were quite a few adult dogs that were being abandoned in the streets. And so we really wanted to understand why some of those cases of abandonment were happening. So the next phase of DPM is also going to include some more detailed research into human behaviour. We also wanted to make sure we had sterilisation services available for those community-owned dogs that we knew were quite successful breeders. So I don't want to oversell initial assessment. It provides you evidence-based insights into what's happening in your dog population dynamics, but there are often unanswered questions remaining and assumptions that are remaining. And I think that's fine so long as you can recognise those assumptions and clarify them. Because what we want to do going forwards is to monitor our indicators relating to our DPM intervention so that we can test whether those assumptions are true. We want to make sure we give ourselves the time and brain space to evaluate the data collected through monitoring in order to adaptively manage our DPM interventions, to continually improve them based on the evidence that we find for successes and failures. Dog population management is a permanent challenge. Wherever we have people, we will have dogs, and some need to manage their population to minimise risks and maximise benefits. We sometimes talk of 3 to 5 year DPM projects, which is fine, but those need to then roll seamlessly into the next phase of DPM because this is a permanent challenge. Now, this question of monitoring and evaluation, how to actually do that practically, was something that ICAM has focused on quite recently and was the subject of our most recent publication, Are We Making a Difference? So that's a practical guidance on monitoring and evaluation. It provides some how-tos for the various methodologies I've mentioned so far and others. You can download the full PDF document from the website, Or you can use our online tool, which will ask you a series of questions about your dogs and about your intervention. And then based on your answers, we'll select that content that seems most suitable for you and that create you a shorter PDF document. Our audience for this document is very much those DPM implementers, so the people that are in the field implementing DPM, but also donors to those interventions. And we are very much focused on resource-limited communities. Okay, so we hope that we have conducted an initial assessment and we have some understanding of our dog population dynamics. We've committed to monitor and evaluate our intervention as it progresses. And now the question remains, what are you actually going to do as part of this intervention? And so for this next section, I'm going to draw very heavily on ICAM's Humane DPM guidance. I'm also going to be drawing on OIE's Chapter 7.7 of the Terrestrial Animal Health Code. That's their Stray Dog Population Control Standard. So we have 6 main areas of tools for ethical DPM. First of all, this tool of education or behaviour change of owners and professionals is a really very large and creative area of tools. I think gone are the days of relying purely on leaflets and puppets in classrooms. Not to say that those are not effective tools, there are, but they're not effective on their own. They're no longer sufficient. Our ways of communication and education have changed so much over the past years and are continuing to evolve. So we're just going to give you one example here. This is actually from a cat population management programme in a deprived area, inner city area of the UK. This is a cats protection project, and they used a community art project. So they got local people to decorate and display these wooden cutouts of cats around their community. They then linked those with a social media campaign, and that social media campaign was focusing on improving people's motivation for spaying their females before the first unwanted litter, and also focused on exposing all the potential places that people could go for affordable, low-cost spay for their cats. When we look at legislation of breeders and sellers, we're trying to encourage responsible breeding. We don't want to stop people breeding dogs entirely, but we need responsible breeding with dog welfare as the priority. Ideally, you need that legislation to be agile. The supply chain for puppies can change quite quickly, and the process by which people buy puppies has also changed relatively fast over the past years. Consider how many people now purchase a dog online as compared to 10 years ago. When we look at legislation focused on owners, we're trying to make sure that cruel and neglectful behaviour is illegal, including abandonment. But we also have an opportunity to encourage responsible dog ownership that has the capacity to build good welfare for our dogs. And that's something that the Code of Practice for the Welfare of Dogs tried to do. It includes a list, quite a detailed list of owner behaviours that will help owners comply with the Animal Welfare Act in the UK. But it also goes further and suggests those behaviours that can lead to good welfare and good well-being for the dogs. When we look at registration and identification, that of course can become part of legislation. It can be a very effective way to improve reuniting of lost dogs. I think one of the challenges around registration identification really is the database that is behind it, ensuring that it's easy for owners to maintain and update their information so that it's current, and for people who have found a lost dog to be able to access the data so that they can ensure the owner knows that their lost dog has been found. And I'm excited to hear Marta's presentation from Animal ID, where they have developed a process of registration identification that includes QR tags. So those are tags that can be read with any mobile phone that are used in addition to a microchip, and that's, I think, quite an exciting innovation. When we look at veterinary care, we're looking in particular at sterilisation and vaccination, but also ongoing veterinary care for things like parasite control and, of course, treatment in the case of illness or injury. We want to make sure that veterinary care is accessible for owners, so not only affordable, but actually physically, geographically accessible for them. I think it's wise to potentially try to avoid free veterinary care. We want to, as much as possible, increase people's value in the importance of veterinary care for their animals. And we also want to consider issues of sustainability going forwards. it may not always be possible to demand that owners pay for veterinary care. It may need to be a phased approach in some communities. And I think where we have a community-owned population that is well tolerated, CNR can be a really great tool because it allows you to manage those dogs in situ without needing to bring them into a rehoming centre where you have associated welfare risks. But there will be locations when CNR is not appropriate, and there will be some dogs for which CNR is not appropriate. And of course, CNR needs to be run with a very thoughtful mindset when it comes to increasing community engagement and ownership over those dogs. Where we have a rehoming capacity, holding facilities, rehoming centres, or ideally foster systems can provide a way of making sure we can move dogs from one home to a new home. Rehoming centres can also provide a site for other services. So, for example, the Footprints of Joy shown in the photo here is a shelter, a rehoming centre in Cernavodă in Romania, run by Save the Dogs and Other Animals. They're about to open a new veterinary clinic on that same site to provide affordable veterinary care for the local community. And then we have the issue of euthanasia. Now, this is very often the elephant in the room when we're talking about ethical DPM. I don't want to leave it as the elephant in the room. I want to address it straight away. So when we look at these two first points around euthanasia, they're normally acceptable to most. So firstly, that the methods of euthanasia must be humane, and you can look at the OIE's Chapter 7.7 Stray Dog Population Control Standard for a list of methods of euthanasia that the OIE consider to be humane. And then also the second point, that any DPM intervention that engages directly with dogs must have the capacity to euthanize dogs humanely to hand, so that dogs that are suffering can be euthanized when that's necessary. So I'm going to read directly from the ICAM DPM guide relating to that particular point. When running holding facilities and rehoming centres or networks, euthanasia will be required for animals that are suffering from an incurable illness, injury, or behaviour problem that prevents them being rehomed, or are not coping well enough with the facilities to maintain a reasonable level of welfare. Ultimately, a successful population management programme should create a situation where these are the only occasions when euthanasia is required and all healthy animals can be found a good home. So far, so good. But it's this third point where differences can arise. And I need to emphasise at this point that although I'm quoting from the ICAM DPM guide, I'm not speaking here on behalf of all ICAM members. Each member does have their own euthanasia policy. So this is direct from the ICAM DPM guide. In reality, however, most countries will not be able to achieve this situation immediately, and that's the situation where only unhealthy animals are euthanised. But we'll need to work towards it, accepting that some healthy animals will be euthanised as not enough homes exist that can provide a good level of welfare. Euthanasia deals only with the symptoms and not with the causes of population problems. It will not lead to population management and must not be relied upon as the sole response. Now, discussions around this point are often had in the black and the white. So clearing the streets of the stray dog menace versus never culling a healthy dog, the right to life. And I think in reality, most discussions probably need to end up in the grey in between. So I identify very strongly with that no-kill ethic. I think who gives us the right to take away the life of a dog because it doesn't fit our homes or fit our perception of the streets. And I think we should celebrate those countries that have already achieved that goal of never euthanizing a healthy dog. However, I have also seen the horror that can be created from a no-kill ethic forced upon a situation where the number of dogs far outstripped the resources required to maintain a good level of welfare. And I do believe there are worse things than death. I also don't believe that we have the right to impose suffering on an animal so that we can live by our ethic. So that euthanasia of healthy animals must only ever be used as a last resort. Explore every other opportunity of rehoming. Ideally, don't bring the dogs into the centre in the first place. If you can manage them in situ through catch, neuter and return, then do so. And euthanasia of healthy animals must never be considered as a solution to DPM. Okay, so what I've described here is this DPM pathway, starting with establishing priority problems and therefore objectives, then a process of initial assessment to expose the states and processes within dog population dynamics and clarifying assumptions, allowing you to design intelligent intervention based on evidence, then implement that intervention, monitor its progress, and give yourself the time and the space to evaluate that data and adaptively manage the intervention so it can consistently be improved and evolved over time. But the question remains, who drives this? And this is something that Harry Ekman will be picking up later in the day, describing the potential of using a multi-stakeholder community group to drive this entire process from the inside of the community and therefore create a sustained and intelligent DPM intervention. So I'd like to finish by just sharing two DPM examples, and they're from two very different countries to show the variation of DPM interventions from the UK and then the other one from Kathmandu in Nepal. So starting with the UK, we have 9.3 million dogs in the UK. We don't have a community-owned dog population, but we do have dogs that end up on the streets every year, and we collect around 100,000 dogs per year from the streets. We have a relatively large rehoming centre population. We have a large rehoming centre system of about 250,000 dogs. We do have a reasonable adoption rate, so 22% of owned dogs are adopted from rehoming centres, which is good. But that combination of relinquishment and collecting dogs from the street actually exceeds adoption at this time. So we do still euthanize a small number of healthy dogs each year. Unfortunately, we do still euthanize quite a large number of healthy cats. And I think anyone working in companion animal welfare in the UK is quite focused on that goal of getting us to zero. So relinquishment of dogs in the UK seems to be majority as adults. So we have a 71% sterilisation rate of owned dogs. So we don't have many unwanted litters. We don't commonly get litters of puppies relinquished to shelters. They're more likely to be relinquished as adults. And that seems to be related around issues of acquisition. So we do still have impulse buying. We have around 13% of owners purchasing puppies with no prior research at all. We have 13% of owners doing no dog training at all with their puppy or their adult dog. So we have then related issues of poor socialisation and training. And we know that those are risk factors for later relinquishment. We have unrealistic expectations in our dog owner population, and we have issues of poor and illegal breeding. Now, I think it's at this stage that my sort of ecological model of dog population dynamics is exposed to being just too simple. So this process here of purchasing from breeders from this single breeding population is just too simplistic. We don't just have one breeder population in the UK, we have many different types of breeders, from your sort of kennel club registered pedigree breeder through to puppy mills, through to puppies that have been illegally imported into the country. So a lot more research and investigation has gone on in the UK into these different breeder populations and that process of purchasing or acquisition from these different types of breeders in order to design more targeted interventions dealing with that process. I did also at this stage want to mention the PDSA Paw report. I used that for the statistics that I've mentioned in this slide. The PDSA is a charity in the UK that invest every year into research into the pet owning population in the UK, and therefore has provided this sort of relatively long-term set of indicators around owner behaviour that I think is proving to be really useful for planning ongoing pet management interventions. Okay, so I want to just focus on a few of the interventions, the most recent ones in the UK relating to dog population management. including the fact that it became mandatory in 2016, so last year, mandatory to microchip and register your dog. And that particular tool is focused on that process of reuniting lost dogs. So of those 100,000 dogs that are collected from the streets every year, the majority of those will be, or many of those will be, lost owned dogs. And by introducing mandatory microchipping and registration, the aim is to improve the speed and effectiveness of reuniting lost owned dogs with their owners. We also have campaigns targeting illegal import of puppies, which appears to have been increasing in recent years, most notably from certain countries in Eastern Europe. We have this particular tool, the puppy contract, released quite recently by a group of organisations. The puppy contract is trying to improve the responsible acquisition of puppies. It includes a checklist of questions for both the buyer and the breeder, and the purpose of that is to ensure that the buyer has truly understood the responsibility of owning a puppy, so that they know that the decision they're making is an informed one. The questions for breeders are quite searching in terms of the provisions and their behaviours towards both puppies and parents, so hopefully that will encourage responsible breeding. And there is also a formal contract involved in this puppy pack, and that formal contract can be used as a legal basis in the case of later problems. And quite recently, we've also seen our veterinary community coming together to challenge those breeds that have potentially inherent welfare problems. So in particular, these brachycephalic breeds. And it's been really fantastic to watch that professional veterinary community come together in a very coordinated and strong fashion behind the issue of dog welfare. That's been great to see. And of course, the DEFRA in the UK, they're the government department responsible for DPM, have been looking to reform legislation currently, mostly relating to breeders and vendors. There is the potential there that they could look to ban certain breeds on the basis of welfare. They could also look potentially at increasing the age of import of dogs to 6 months post-Brexit. So those are some of the things that they may be discussing at this time, and we'll have to see what comes to pass in the months and years to come. Okay, now moving to a very different environment, to Kathmandu in Nepal. So that's the capital city of Nepal. And the ICAM Coalition have been providing support to HSI and the local partners in the process of initial assessment and most notably at monitoring and evaluation. So through a combination again of street surveys and household questionnaires and focus groups, we're able to expose various factors about the dog population dynamics in Kathmandu, including that about 30% of households own dogs in this capital city, which is quite high for an urban area. 53%, so over half of the owned dogs, are allowed to roam for at least part of the day, and only 20% of them are sterilised. So we have high dog ownership and a lot of roaming and unsterilised owned dogs. When we asked people that question, the same one as we did for Trebinje, we asked people if they knew about a litter of puppies that were born in their neighbourhood in the last year. Of those people that did know of litters, 83% of them knew that at least one of the pups had been abandoned in the last year. So clearly abandonment of unwanted puppies, the issue of unwanted litters, is a real potential source of the roaming dog population. We found that 40% of people feed street dogs. We found 9% of the current roaming dog population is lactating, so it's a relatively well-fed population, and they are breeding. And we also found that 19% of the females are already spayed, so that's great. We have some past DPM interventions to build on. There's already a foundation there. Okay, so the new project that's been running now in Kathmandu is called Manamitra, Friend of Human, and I'd like to describe some of the key features of that project. So first of all, it has quite an interesting management system. So there are 32 different wards in Kathmandu. Each ward is being capacity built with its own animal management unit, and that animal management unit includes community volunteers, animal handlers and many volunteer members. And what we see in this photo is a community volunteer from Manamitra talking to community health volunteers within that ward. So the ladies that you see here in this photo are part of a community health project focusing on child and family health. So for example, they're looking to make sure that children get their polio vaccines. And what Manamitra is doing is kind of piggybacking on those already existing community networks and projects with messaging around rabies control through vaccination and through the opportunity to have dogs sterilised. And the other thing that these ward-based units get involved in is participatory research within their ward. So we have this initial assessment across the whole city, but then each ward also follows up with more detailed participatory research within their own ward, and that builds their capacity and also their ownership over that data. So they have the ability to then measure their own impact within their ward. Following that, there's this process of community sensitisation. Again, the ward unit gets to decide how they want to do that. And this photo at the top here is a photo from a ward that decided to use a street march to sensitise the local community about the importance of dog vaccination for rabies control and the opportunity to have their dogs vaccinated and sterilised through the project. And about 200 people took part in this march, and that's from a ward of about 8,000 people. So we can see that the dog issue is really quite important within that community. And then there's also school education programs run in bite prevention and bite treatment to avoid rabies. They also include dog health camps. So this photo up here is a dog health camp set up outside a temple on a Saturday, so when fewer people are working, so they have the opportunity to bring their dogs for sterilisation and vaccination. And they also run a community dog sterilisation and vaccination element with full community action. So the members of the community that are feeding dogs are asked to help handle and capture those dogs and identify them, and then provide post-operative care and ongoing care, such as rabies vaccination boosters in the years to come, with support from Manamitra. So I think this is quite an exciting new project in Kathmandu in Nepal, and ICAM have been very pleased to be able to offer some support to their monitoring and evaluation. So just in summary now, what I've described here today is this process of an evidence-based DPM. So starting with identifying priority problems, so you can have these clearly stated goals against which you can monitor and evaluate your impact. Then using the process of initial assessment to expose the state and processes within the dog population dynamics. We know that there is no one-size-fits-all DPM intervention. You need to work with what you're given and design your intervention intelligently based on what you understand about dog population dynamics in your particular location. Your intervention needs to be designed to target the source of roaming dogs, not only the symptom of the current roaming dog population, so that you're working at both the cause level and the current dog population cause and not only symptom. The activities involved in the DPM intervention must respect animal welfare. You need your intervention to be ethical and humane, otherwise you will not be able to engage the community in your work. You need to monitor your indicators as you progress. You need to give yourself the time and the brain space to evaluate that data. And that's a very important thing to keep in mind. Far too often DPM interventions spend quite a lot of time trying to capture data on what they're doing, but don't give themselves the time to review that data and to learn from it. And it's essential that we use that evidence to adaptively manage our interventions, to evolve and improve them over time. DPM is a permanent challenge, and we need to be intelligent in our evolution of our intervention so we can keep step with changes in dog population dynamics in our location. And the remaining question that I know that Harry Ekman will be picking up on later, Harry Ekman from IFAW, is who drives this process, and he'll be describing the opportunity to use a multi-stakeholder community group to drive this process of DPM, evidence-based DPM. I like to just finish by mentioning a few resources. First of all, the 2 ICAM guides that I've mentioned a few times in my presentation, which you can access from the website. The OIE Standard Stray Dog Population Control, which is Chapter 7.7 of the Terrestrial Animal Health Code, and then a chapter that I wrote in The Domestic Dog, which is a book edited by James Serpell. And then I just want to thank you for your time and attention today.